to a brand new state-of-the-art brain and mind care facility here in Chennai. Brain stimulation to psychological therapy, Ayurveda to yoga, cognitive stimulation to naturopathy, physical, occupational and speech therapy, we are the pioneers and innovators of integrative care for the brain and mind.
Welcome to Buddhi Clinic. Neuropsychiatry as a specialty is one that affects the brain and mind interface. And when we say brain, we know we have an organ there. But when we say mind, we touch our hearts, we touch our heads. The mind is really just the software in our brain, the millions of nerves talking to each other through chemicals. What do we have in our armamentarium to treat these patients? We have surgery for some, medication for many, if not most. But beyond all that, what do we have? And what we do have is rehabilitation, therapy, and care. Now, usually a person with a neuropsychiatric condition will have to go to various places in order to receive these treatments. Imagine if you could get all of them under one roof. Imagine if you could, just by traversing floors, meet experts in every one of these disciplines who are programmed, prepared, and equipped and qualified to help you. And that really is what we offer you here at Buddhi Clinic. The opportunity of blending modern science and ancient wisdom, the opportunity of being able to receive a very wide array of care treatments that can help you. So do come, visit, see what we have on offer, and I'm sure you will not be disappointed. In fact, I'm sure you'll feel exhilarated by what you see here. Thank you.
The basement houses the state-of-art neuromodulation facility. We have repetitive transcranial magnetic stimulation, transcranial electrical stimulation, which comprises of TDCS, TSCS, pulsed and random noise stimulation. We have transauricular vagus nerve stimulation. Along with the neuromodulation, we have yoga and mindful suite, as well as the mind labs, where we are following the traditional as well as the modern way using the computerized models of assessment and therapy.
Welcome to the Neurodiagnostics lab. So this suite is well equipped to run all our electrophysiological assessments. So here we do the EEG, the nerve conduction studies. We also run the autonomic tests. And here you can see the tilt table, which is used to do part of the autonomic testing. This suite also has a state-of-the-art sleep lab. It's a very comfortable space where patients with sleep disorders have an overnight polysomnography, that is the sleep study. So you can see that this is a suite which is very well equipped to run all the neurodiagnostic tests for patients with neuropsychiatric disorders across the lifespan. Welcome to our advanced gym facility on the rehab floor. Here we have equipment which is customized to address physical disabilities for patients with Parkinson's disease, for stroke, for traumatic brain injuries and various other neurological disorders which cause a lot of distressing physical disabilities. These are our mobility lab suites, a part of the rehab floor. And here our well-trained and expert physical therapists deliver interventions such as electrotherapy, manual therapy and exercise therapy for patients with pain, balance and posture issues and autonomic symptoms, among various other physical symptoms of neurological disorders. This is our Dr. Deepa Krishnan Neurodevelopmental Therapy Suite, and here our physical therapists work with children with neurodevelopmental delays. On the rehab floor, we have the speech and language therapy suite, where our speech and language pathologist delivers speech interventions and swallowing maneuvers to children, adults and elders with speech and swallowing disorders. The second floor is dedicated to holistic care. So we have the complementary and alternative medical treatments. So here we have 2 dry therapy suites where we do acupressure, reflexology and meridian massage. And here we have 3 wet therapy suites where we do treatments with medicated oils, powders, with foments, and we use mud packs, after which the patient can go across to the bathroom and have a bath. And these treatments are used for a host of physical, cognitive and behavioral symptoms which are very common in neuropsychiatric disorders.